Okay, like I said, this is the Intersectoral Collaboration webinar, and I'm Caroline Abla, the ISC Help Desk. We're going to discuss today just an introduction and talk about the webinar objectives. Then Anthony will take us through a brief history of the GNC ISC engagement. We'll talk about the GNC ISC structure. We talk about intersectoral collaboration also at global level, and we will have Monica Ramos, the Global WASH Cluster Coordinator, who will take us through that. And then we'll have some country examples of ISC support. DRC was going to be talking, but Khalil had to go to the field, so he sent me some notes. But Claude from Burkina Faso will talk, and anybody else who wants to share experiences receiving ISC support is welcome to do so. Then we'll have a Q&A session. So the objectives are really to raise awareness of the work that the GNC is doing on intersectoral collaboration, to introduce you to the GNC Help Desk and the support that it can provide to cluster coordinators and teams, and really to generate demand for ISC Help Desk services to further the intersectoral cluster or sector collaboration at country level. Anthony will take us through a brief history of GNC ISC engagement. Anthony? Anthony, sorry.
Thanks, Caroline. Thanks, everyone. Thank you, colleagues, for joining. I will all briefly talk about the GNC's engagement on intersectoral collaboration work. I'll be primarily talking about the extent to which GNC has given intersectoral collaboration as a priority over the last years, and also the level of effort put by the GNC, its partners, and also other clusters, so that you know where we have been and what is happening right now and what the future priorities will be, so that countries could benefit from the ongoing and the past work on the intersectoral collaboration. So over the last years, I would say the GNC work on intersectoral collaboration has focused primarily in two major areas. One, ensuring within GNC and other collaborating clusters that intersectoral collaboration is an important pillar of emergency nutrition preparedness and response. And what does this mean is that intersectoral collaboration is not an afterthought. It is really rather an integral, essential component of emergency nutrition programming and coordination. And another aspect which GNC has been focusing is exploring ways of doing, seeing what are the practical ways of operationalizing intersectoral collaboration in the field. So these were the two main areas where GNST and the other clusters have been focusing. So when it comes to recognizing intersectoral collaboration within GNC as a really important pillar of nutrition preparedness response, as you can see, over the years, the GNC strategy documents have clearly shown that intersectoral collaboration is really one of the priorities. And even before that, earlier on in 2012, the GNC has started working closely with the Global Food Security Cluster, and they formed a collaborative platform, which is called Intercluster Nutrition Working Group. So the group was chaired by the Global Food Security Cluster and the GNC, and also through time it included the other nutrition sensitive clusters, the likes of health, WASH, and also at times also the health cluster and also other cross-cutting clusters like protection, child protection, and education. And also in the strategies of 2014 and 2016, it is clearly spelled out that reviving intersectoral collaboration is very important. Developing guidance on inter-cluster work is also essential. And similarly, in the GNC 2017 and 2020 strategy, influencing and advocacy for integrated and coordinated response was one of the priorities of the strategic plan. So it clearly shows that within GNC, there is a recognition of the fact that intersectoral collaboration is an important pillar of nutrition preparedness and response, and the nutrition risk and also the outcome of nutrition is very dependent on the nutrition sensitive and other cross-cutting sectors response. So it's very essential to recognize this, because this is not just for the global level, it applies also to the national level. Caroline, I don't see the slides on the screen. Hello?
Yes, I'm not sure I can. Yes, sorry. I don't know. I can see them on the screen here, but I can't see them. I don't know. Something happened to the screen. Sorry.
Okay, maybe you, while you start to retry to screen share, I will continue from what I see from here. Or maybe if you can't, I can also screen.
Yeah,
Okay.
What do you see? Okay.
I do not see anything. Yeah, I don't see anything shared on the screen.
Yeah. Now?
Yes, and the screen is not clear. I think there is some blurring. Yeah, now it's very clear. So you can make it on.
Yes, I see it.
Yeah, on yeah, slide
show.
Yeah.
Yeah. Should be. There we go.
Okay. So as I said, GNC considers intersectoral collaboration as a critical priority, essential element of nutrition preparedness and response. And for that very reason, it has been incorporated duly in the strategic documents of 2014, 2017 to 2020, and possibly as you may know, we are also working right now on the 2021 plus strategic document, which will be discussed during the upcoming GNC global meeting. Hopefully, intersectoral collaboration will be one of the focus areas for the coming years. So the other aspect which I mentioned earlier is GNC is also recognizing the fact that there is a gap in understanding what intersectoral collaboration, integration, multisectoral programming, multisectoral coordination is. So the people have different operational definition of what it means, and there are different ways of doing this collaboration if you look at the practical aspect in the field. So there is a need to clarify what do we mean by the intersectoral collaboration, what does it look like in terms of coordination, and how does it look like in terms of programming in practice. So that required making sure that there is a work in documenting learning, sharing experiences, developing guidelines, and also training and capacity development on intersectoral collaboration. So some of the works which show this effort is, for instance, the 2070 meeting which GNC Global Food Security Cluster, WFP and UNICEF organized, and also FAO, organized in Rome to discuss the practical aspect of famine prevention. This is specifically focusing on countries which are at the risk of famine, like northeastern Nigeria, Yemen, South Sudan, and Somalia. So during that discussion, they came up with some actions that need to be implemented in order to minimize the risk of famine in those countries. And this initial discussion led to the need for coming up with a very comprehensive guideline and also a training package so that most other countries can also benefit. So again in 2017, there was a technical discussion in Geneva that came up with a formation of a group called the core group, which worked together with a consultant on the development of a training package or inter-cluster collaboration. That training material is still valid. It is available in GNC website, and we are using it up to now. So, and subsequent to that, also, the intersectoral collaboration discussions, both at the country, at global level, and also ongoing coordination through inter-cluster nutrition working group has led to the importance of mobilizing resources to ensure that the available guideline tools are also put into practice in the field level. And luckily, GNC got a funding from the BHA. It still also is, the grant is available till the end of the year. And by making use of that resource, GNC was able to establish intersectoral collaboration help desk, which Caroline currently leading. Before her, it was Danka. And the help desk has been leading and supporting countries in making sure that intersectoral collaboration is applied in day-to-day service delivery, also throughout the humanitarian programming cycle. So in addition to the country support, the intersectoral collaboration does a lot of things at the global level. I am not going to talk about that right now, but Caroline will take us through that. But a lot of discussion with the different clusters has been happening, and there is an understanding that there is a need for revisiting the configuration of the intersectoral collaboration, meaning, as most of you may know, previously there is a feeling that we need to work with other clusters to make sure that they are nutrition sensitive. But in that way, it creates an impression that we need something from them, but not vice versa. So instead of that kind of approach, there is a need for to really change the mindset, more to focus on a win-win approach where all these nutrition sensitive sectors and possibly others collaborate in order to maximize impact for all the 4 or 4+ clusters. So that work has been ongoing, and there is really improvement in the collaboration among the 4 clusters, and hopefully it will improve also in the future. So in summary, this is just to share with you that GNC considers ISC as an important priority, and GNC also at the same time recognizes that there is a lot of learning that needs to be documented, shared, and applied. And also there is a need for countries to recognize ISC as important, essential pillar of the nutrition preparedness and response. And for that, GNC has available resources, training packages, and also a dedicated capacity to help you in making sure that intersectoral collaboration is applied at the country level. So I stop here, and Caroline, I hand it back to you. Thanks.
Okay, thank you so much. Anthony, thank you for taking us through this brief history. The next thing we're going to talk about is the ISC, the ISC help desk and the intersectoral working group. And after that, Monica, who just joined us, will take us through the global level and perspective. So the help desk was funded since 2019, like Anthony said, and the help desk, really, the work focuses primarily on capacity building, documenting and learning, and day-to-day remote technical support on IEC to clusters and sectors. Very recently, actually in May, last month in May, it started April, May, we started a working group at the GNC called the Intersectoral Collaboration Working Group. And this group was formed really to assist the GNC in developing a sectoral perspective and priorities of how best to collaborate bilaterally and multilaterally. And this group supports the GNC in maximizing opportunities for more effective and efficient collaboration across sectors to really achieve commonly agreed on objectives, and really focus on common objectives. Like Anthony said, it's not only what's in it for nutrition, it's also what's in it for the other sectors, and how do we all work together in order to improve outcomes for health, for nutrition, for WASH, for food security. We're also engaging with protection. We're probably going to engage more with education, and as it goes. So the Intersectoral Collaboration Working Group comprised of representatives from GNC partners and country-level coordination teams with expertise and interest in intersectoral collaboration. So what does the ISC at global level look like? We have specific work modalities between the 4 clusters, and Monica Ramos, the Global WASH Cluster Coordinator, is online and will take us through that. Hi.
Hi, everyone. Thank you so much, Caroline. Thanks to you and Anthony for having me here today. It's really great to see so many new faces for me. I don't know a lot of the nutrition colleagues working in coordination, so I hope that this is one of the first, one of many first or occasions that we can come together. So basically, yes, thanks so much, Caroline, for having me here. So I actually joined as the coordinator in September of the Global WASH Cluster, and we had already started some conversations with Health, WASH, and the Nutrition Cluster, the other global leads, really about how we can have a more kind of structured but also balanced and neutral approach to really coming together around commonly agreed objectives. And really making sure that, while it is very important to have, for example, a nutrition sensitive approach, it's also or a WASH, specific approach, it's very important for us to come together, and try to have more intersectorial approaches to maybe kind of really like more thematic areas that we're all intersect in. So we really decided that it would make a lot of sense if we wanted to really increase our engagement to come together more regularly, to actually kind of have a platform for this, which we now call the intersectoral platform for collaboration. And it's kind of, the idea is that, some people said to us, well, is this a duplication of what already happens with OCHA's Global Cluster Coordinator Group, the GCCG? We said not really, because the idea here is to really, drill down and have that opportunity to drill down into the way that we intersect with different clusters across different sectors, across different thematic areas, because in some cases there will be times that it's really about a WASH and a shelter approach, or a WASH and a shelter and protection approach, while it may be a WASH with a nutrition with a health approach. So we're really trying to make sure that we're able to come together, 3 or more clusters, and really agree on these common objectives at both at the, at global level, regional level, and country level, and really to get that synergy across as well. And I think, what's really interesting is, particularly from the WASH side, we recently, we led this, but now it's really being, taken up by the sectors, this development of a roadmap strategy, a 5-year strategy for what we need to do in the WASH sector to strengthen our capacity and our resources. And we're actually two initiatives, and there was an implementation plan that was designed, one that really looks at the integration or the collaboration, I should say, between WASH, nutrition, and health across public health emergencies. And so we've seen that we've been trying to do various events together. As of recently, we were all together at a global health cluster partners meeting in April. We were all together at the GWC satellite events. I know we're coming together again in later this month. We're in June today at the GNC meeting. So the idea is really to also create these synergies at global level, but also really working with countries. So I mean, we've been doing work with all of you, particularly in South Sudan. I know we've got DRC, that's another priority for us. Been reaching out to really kind of have those initial discussions to really identify what can we do at the global level to support all of you at the country level? Is it developing guidelines, implementation plans, maybe potential trainings, developing frameworks? I know that we're also looking very much at the famine and the integrated response framework. So this really also ties into the work that we were already just starting to do in the WASH sector by saying, hey, we really need to come together in a more structured way, and really with the sectors that really are strong and with strong linkages that we have across different thematic areas that we work in. So this was kind of the idea. And just maybe to flag, and then maybe Caroline, I will have to hand back over to you. Well, I can probably do 7. I'll try to do 8 maybe quickly, and then I'll have to run. We're really trying to look at as well, we're bringing someone on board under a consultancy arrangement, very similar profile TOR to what Caroline is currently providing support to the GNC. I understand the GHC as well, the global health cluster is also looking at this type of role to be part of the global coordination team. So I think we're all really kind of coming together at the right time to really synergize as well, and really kind of say, okay, how can we put all of these pieces together, and how can we really work more efficiently and more effective together? So maybe we could just go to the next slide. Caroline, these are examples. Great, we're there. So I was following the presentation on my computer. So thanks to the Global Nutrition Cluster, really the idea. Oh, sorry. Let's go back to the different events. We're looking at supporting in a. Sorry, can we go back one slide? The slide 7. Yeah, so we're looking at having a high-level donor meeting around intersectoral collaboration. So this is really thanks to the GNC, because you've been leading that relationship. But we're all jumping in together with health and food security and WASH. We're working with one of the key partners, I think, across a lot of our clusters, which is Save the Children, to develop a joint advocacy statement on famine that we're all going to then endorse together. We obviously, as I said, been doing this new kind of annual meeting. It's been very organic. And it's been kind of, we learn by doing, but I think it is really starting to really, I think the partners are really reacting well. They really like the idea that we're talking about, how we can better work together in a more holistic approach. Caroline led on a field survey that we did across the 3 clusters. So with us and health, and nutrition, to just kind of see what the barriers are, what the motivators are, what we can do to support all of you better. And then obviously there's the examples of some of the things we were mentioning with, the WASH and the health and the public health emergencies. We last year did put out a joint operational framework for cholera with health that needs to now also include nutrition. But, we're really just still trying to pick up the pieces, and we really want this to be, we want it to be structured. We're not talking about anything heavy, no crazy TORs, no insane work plan, but really just trying to focus on the touch points where we can come together at the global level, and also really looking at how we can prioritize our work for all of you, to support all of you in the countries that that we see that we have strong linkages. And then just quickly to I won't go into detail on this one, but the idea here is really just this idea of the 3.3, the initiative that I was mentioning earlier from the roadmap, is that it's going to have a phased approach, and a lot of this phased approach is we're already doing it. It's already trying to explore, what is already happening out there, what are the challenges, what are the gaps, how can we build on this, how can we look at, increasing the tools and the frameworks. Particularly, we know there's strong linkages, obviously, around the public health emergencies, as I said. We're bringing someone on board that will help us really move through these phases over the next 6 months. And the idea is that basically the next time that we get a phone call or an email from one of you that says, hey, we really need to know more about how we do intersectoral integration? Do you have models? Do you have tools? Here on the ground, we're coming together with the other clusters, and we'd really like to know how we address it in a famine situation, in a public health situation, and there can be a lot of other situations out there contextually that we're all working in. How have you done it? And the idea is to really share those case studies, and to really share tools and frameworks and make sure that this is something that can also be adapted to your context in your country, and that you also know that you have our support, because we are really working on this. Caroline knows, I think 25% of my emails in a day go to Caroline and Anna now, and also to our health colleagues and food security colleagues. So it's a really exciting time. And I think that, if you all in your countries grab your WASH colleagues and say, hey, I was at this interesting webinar the other day and understand this is going on. We've been also communicating to our WASH colleagues in the field, this is important. This is going to be a huge part of our upcoming strategic plan, which will also be developed in the next 6 months. And so we really just want to see how we can increase this engagement. Because I think so far, Caroline, I would say I think it's going quite well between WASH and nutrition. And I think we're also getting really good traction to bring other clusters and other, the other sectors on board to see how we can all come together. So I'll stop there.
Yes, thank you so much, Monica. Yes, you gave the big picture, and I agree. We're working much closer together, and we're supporting the field together. The 4 clusters. There's a lot of good work that is happening. Perhaps we can continue. Thank you so much. I know that you were very busy and you just jumped in to help us with this session. Thanks a lot.
Okay, thanks. Thanks, colleagues. All the best. Bye.
Thank you. Bye. We talked about the health, WASH, and nutrition. We did a survey, it was really a very quick and dirty survey. I think some of you may have responded to this survey. We sent it to the cluster coordinators at country level, the health, the WASH, and the nutrition ones. And we basically asked about constraints for ISC, both at the national level and at the subnational level. And the results that we found is that time again from all of the clusters and sectors, that funding and staffing have been an issue, have been a constraint. Enough funding, agreed on funding in specific areas, and enough staffing who are able to implement. And that is both at the national and at the subnational level. And then also we found that advocacy, the ability to advocate at subnational level for intersectoral collaboration was a constraint. So this points to us that there may need the field may need some assistance in how the subnational level can advocate for ISC. The other questions we asked is, do you have an integrated package of intervention? And 50% of the respondents, this was 38 total respondents from 23 countries. So the clusters, the 3 clusters, 50% of the respondents said that they had an integrated package of interventions, both at national and subnational level. And again, the major constraint is staffing and funding at all levels. The ability to advocate for and leadership on integrated and subnational level. So really these are interesting results, and then we support from the global cluster to ensure effective intersectoral collaboration at country level. And the top 3 priorities were support with developing work plans for ISC, support with training on ISC, and again, I just heard it last week, again from DRC, but also from others, and then guidance on intersectoral collaboration at country level. We do have examples from different countries, we have different tools, but how does all of this really become useful to country level? How does it become a guidance for country level? So like Monica was mentioning, that the global health cluster and the global WASH cluster are also going to have an ISC help desk soon, I hope. So these three top priorities that the field has dictated will also be the priority of the three of us working together on these issues. Again, once, for example, the global food security cluster also is staffed to have some time to dedicate to this work, they will also be included. We'll also look, like I said, at other clusters like protection, like education and others to bring in slowly. I think that is going to be phased and at a later stage. Are there any questions? Is everybody hearing well? Okay, we'll have questions. We'll have enough time questions at the end, but if there's anything burning before I move on the slide. Okay. So I just wanted to provide some examples of assistance that the ISC help desk has provided. The support to countries during preparedness needs analysis, response planning, implementation phases of the humanitarian program cycle. These are all places that you can, we can help you and work with you on. Identification of key ISC activities to be incorporated in the HRP and HNOs. I know that the support has been provided, but the upcoming HNOs, you can reach out and we make sure that you are supported with any questions or as you develop how you see the ISC in your country. We're supporting also Francophone countries on the emergency response plan training, and in that training we've really incorporated ISC as an integral part, really having, when people are doing their contingency planning, looking at intersectoral collaboration. Then we have one-on-one support. You can reach out and we can schedule one-on-one calls. They could be, we have 9 priority countries, and with those there are monthly calls as well as ad hoc calls, depending on what kind of issues come up from the field. So that's a way we can work with you. You can send an email and we can schedule a call to discuss the issues. We provide specific support on ISC planning and action plans and integrated packages of interventions. I know some countries have worked on their integrated packages of interventions, and there was either active involvement when they were being developed, or at least feedback once they were in their draft stages, and support and feedback from the desk. We can share documents and lessons learned between countries. We've done that a lot recently with the GBV audit in nutrition programming that was used in South Sudan. This was shared, for example, with Venezuela and Northeast Nigeria, and can be shared with anybody else who's interested in incorporating a GBV audit in their nutrition programs. As well as we shared the example of ISC action plans and integrated packages. Are also able to present at country ISC meetings. If you have a meeting that you've set up and you need us to present what is happening at global level, this is what we just recently did with DRC. Or if you want us to present on, what is collaboration and in programming between the nutrition and the WASH cluster, or nutrition and the health cluster look like. Okay, sorry, I've been falling behind on the slide. All right, then the case studies. You already heard that we've worked on 2 case studies with South Sudan and with Yemen, and we're currently in the process of working with 2 other ones with Burkina and DRC. But not only case studies, I think there are also opportunities to showcase the work that you are doing on ISC in writing articles to field exchange, for example. So if you need support in thinking through something like that, an article for field exchange, we're also able and happy to help. The other one is the ISC training, and that really happened while Danka was here, and then the DRC, CAR, and Chad all had live training in the field, but then we had Corona, the COVID-19 crisis, and the help desk then switched the training packages from a face-to-face meeting to actually online training. And that was done for Somalia online. And then also Somalia had asked for a training of trainer on this package so that then they can cascade the training. And that was developed for them and was implemented also online. So the IAC training material was updated by Danka also. This was the one that was produced about 2 years ago. And now we're working on converting it to an online e-training for field use. So then once it is online, an e-training that you can go into and you can take at your own pace, you can share that also with your partners from the Ministry of Health or your national and your international NGOs, and they all can get that training online. This will take time, but will be definitely before the end of this current grant at the end of the year. I talked a lot, so this next country examples of ISC support. DRC and Burkina will discuss what kind of support that they've received. We'll start with Claude from Burkina Faso because Khalil from DRC is not able to be on the call because he's on a plane going for a response. So we'll start with you, Claude, and then others, if you have examples of the kind of support that you've received from the help desk, and then I will share what Khalil sent about the DRC. Claude?
Yes.
Yes, vas-y. Yes, sorry, Claude is going to speak in French and I will translate.
Merci beaucoup. Je veux expliquer en français comme Caroline a bien dit et il va traduire en anglais. Bonjour tout le monde. Je vais vous présenter l'expérience sur la collaboration intercluster avec l'appui de Global Cluster Helpdesk. Donc, nous avons deux exemples.
I guess I just need to translate. You're saying the greetings and you're going to be discussing the support that was received from the sectoral collaboration help desk. I will wait and do the translations as you talk later.
Donc là, nous avons deux exemples à pouvoir échanger avec vous. Le premier exemple, c'est on a fait la collaboration intercluster ou intersectorielle avec la santé, la HOCH, la sécurité alimentaire et la nutrition pour mettre en place un paquet intégré d'activités multisectorielles de la nutrition en urgence. Ça, c'est le premier. Le deuxième, c'est la collaboration spécifique avec la HOCH pour mettre en place la stratégie HOCH Nutrition au niveau du Burkina Faso. Donc, ce sont là les deux exemples que je vais partager avec vous avec l'aide du Global Cluster Helpdesk. Bon, pour le premier point, l'idée de mettre en place le paquet intégré d'activités multisectorielles de la nutrition en urgence a commencé depuis 2020, juin 2020, et c'était juste pour avoir une réponse complète pour la nutrition, parce que au Burkina Faso, disons, les causes de la malnutrition, comme partout ailleurs, ils sont multisectorielles. Et puis, il y a le problème d'abord qui a commencé avec la sécheresse du Sahel, le problème d'insécurité alimentaire, et après, le contexte qui a changé avec le mouvement des populations qui a beaucoup perturbé l'accès aux soins de santé. Et puis, le problème de l'eau, hygiène et assainissement est toujours lié au contexte du Sahel, où la plupart des zones, que ce soit les zones d'urgence pour l'humanitaire, tout comme les zones qui ne sont pas humanitaires, ont des problèmes sérieux de l'eau. Donc, nous avions préféré mettre nos classes, nos secteurs ensemble pour avoir une réponse coordonnée et puis dans les zones que nous avions appelées les zones de convergence. Donc, et puis, pour mettre ça en place, nous avions obtenu l'aide du bureau régional de l'UNICEF, qui, à son niveau, à Dakar, a mis en place un groupe aussi technique pour nous appuyer. Et puis, nous avons obtenu aussi beaucoup d'aide du Global Cluster. Au début, le Global Cluster nous a aidé à faire la revue documentaire. Là, c'était d'ANCA. Donc, voir quelles sont les expériences qui existaient avant et voir qu'est-ce qui a été fait. On s'est beaucoup inspiré de l'expérience du Sud-Soudan, parce qu'il y a Sud-Soudan, il y a le Yémen, qui ont été beaucoup cités même dans les présentations de tout à l'heure. On s'est beaucoup inspiré de l'expérience du Sud-Soudan. Blanca nous a donné une documentation. Et après le départ de Blanca, nous avions beaucoup évolué avec Caroline, qui nous a donné des outils, parce que l'idée pour nous était d'abord de voir quelles sont les activités qu'on peut mettre ensemble comme un paquet. Avoir un paquet d'activités multisectorielles pour une coordination intersectorielle. Alors, pour définir le paquet d'activités, chaque secteur, nous avions tenu beaucoup de réunions, chaque secteur devrait présenter ses besoins et comment il va apporter la réponse. Et dans comment il va apporter la réponse, les activités, on a essayé un peu de tirer les activités qui pouvaient être faciles à implémenter si on est ensemble. C'est comme ça qu'on a fait un tableau d'activités qu'on a appelé paquet d'activités, où on voit comment dans une zone où nous avons les besoins sont intersectoriels, qu'on appelle les zones de convergence, comment nous pouvons aussi suivre l'implémentation de ces paquets d'activités multisectorielles. Voilà. Donc, maintenant, pour nous y arriver, le Global Cluster, donc Caroline a partagé avec nous une matrice qu'on appelle la matrice de triangulation. La matrice nous a permis de voir quelle activité qu'on peut, quelle opportunité un secteur peut avoir avec l'autre pour implémenter ses activités. Quelle information un secteur peut chercher dans un autre secteur. Donc, on a fait ces jeux pour trouver les intérêts de travailler ensemble, pour trouver les intérêts aussi de créer une synergie. Si, par exemple, la sécurité alimentaire fait son activité, la nutrition à travers la sécurité alimentaire, qu'est-ce qu'il va faire? Et puis la santé, qu'est-ce qu'il peut faire? Et ainsi de suite. La hoche, ainsi de suite. Cette matrice nous a beaucoup aidé. On a beaucoup discuté avec Caroline aussi sur les indicateurs maintenant. Si on va suivre les activités, quels sont les indicateurs conjoints? Donc, un cadre commun d'indicateurs. Là aussi, nous a beaucoup aidé à élaborer ce cadre commun d'indicateurs. Il y a un exemple du Sud-Soudan qui a partagé avec nous, que nous avions adapté, que chaque secteur a regardé les indicateurs et nous allons prochainement le faire valider par nos classeurs. Mais les coordinateurs ont déjà chacun apporté, disons, les indicateurs qui qui sont dans ce cadre qui va nous aider à travailler ensemble. Actuellement, avec le Global Cluster, toujours, nous sommes en train de travailler sur le plan d'action intersectoriel. Donc, un plan d'action, on va faire la réunion prochainement avec les 4 secteurs pour travailler sur ce plan d'action. Mais la nutrition a déjà proposé sur base du formulaire donné par le Global Cluster, la nutrition fait le premier draft qui va être analysé et enrichi dans un atelier. Voilà pour cette partie concernant le paquet intégré d'activités multisectorielles pour la nutrition en urgence. Le deuxième point
Est-ce que
oui,
peut-être je traduis de ce que tu as dit, Claude, parce qu'il y a beaucoup de gens qui ne comprennent peut-être pas. Sorry, so I'm going to just translate. Claude had written to me what he was going to say, so I translated it, and I'll do it very quickly. So the support is that has been provided by the ISC help desk at 2 levels: the development of the integrated package of multi-sectoral emergency nutrition activities, and then the work that they have been doing with the implementation of the WASH nutrition strategy. For the development of the integrated package, the nutrition cluster took the initiative to set up an intersectoral collaboration with health, WASH, and food security since 2020, and with the support of the GNC as well as the regional office. So they worked on the integrated package multi-sectoral activities for emergency nutrition. The GNC support focused on literature review, a lot of the work that Danka had done, technical advice and strategic directions, and then implementation of the experience, capitalizing on strategy through the case studies. So Burkina is also going to work on a case study on their ISC, and hopefully everything will be done on that by September 2021. So some of the things that were shared, like I said, necessary documents from South Sudan, so that they can get an idea of what has happened in other places. We shared with them tools like the matrix of intersectoral multi-sectoral activities, joint monitoring workforce action plans. The desk also provided technical advice and strategic direction. Whenever there was a question, they reached out and we set up meetings with them. And I'm going to go back to Claude for just the nutrition and WASH and nutrition, mais on a besoin de faire un peu vite parce qu'on n'a plus beaucoup de temps. Merci.
Ok. Ouais, en fait, pour la stratégie WASH en nutrition, aussi, là, le Global Cluster nous a aidé à passer l'information au Global Cluster WASH. Et puis, le Global Cluster WASH a été en contact avec le bureau régional section WASH qui nous a aidé à trouver un consultant international, expert en WASH Unit, qui travaille maintenant avec nous pour élaborer la stratégie WASH Unit. Et actuellement, nous avons le groupe WASH Unit qui est fonctionnel. Et voilà, donc la stratégie va répondre au plan multisectoriel de la nutrition du gouvernement dans le cadre du développement de la nutrition. Voilà ce que nous avions fait. Et puis tout ça, nous allons faire, disons, la capitalisation à travers le case study, avec l'appui toujours de Caroline. Merci beaucoup.
Merci, Claude. So the last part that Claude talked about is that they have, with the WASH cluster, they set up a WASH and nutrition working group. The help desk, I think when Danka was here, had started the work on contacting the WASH cluster at global level, and the WASH regional office in Dakar provided an international consultant who's an expert on WASH and nutrition strategy, who is working with them to set up this strategy that should also coincide with what the government is doing on nutrition, right?
Oui, c'est ça.
Okay. Merci beaucoup, Claude.
Merci beaucoup.
Okay. Another quick example I just wanted to give, because I know I'm aware of the time. I really wanted to give a lot more time for questions, but like I said, Khalil from DRC was not able to be to attend this webinar. He's following up on the Goma volcanic eruption, but what he sent was that actually the clusters in DRC have been working together on the ISC agenda, and they're very appreciative of the support that they've received from the global level. It's not only from the GNC, but the 4 cluster coordinators really also provided support very specifically. So they had a training in May of 2019, the nutrition, health, WASH, food security, and NFI clusters on intersectorality, and the training package was and the training package was used in that training, and then from that training they had decided to work on an intersectoral on an integrated package of services, but the workshop just happened last week, yeah, and in March of this year, they received a joint email from the global clusters that were sent to the health, nutrition, WASH, and food security cluster coordinators in DRC. And this email was really to support them in the work that they are doing on ISC, and really was very instrumental in helping them come even closer together and work on ISC. And during the workshop this week, they looked at really putting together a common intersectoral analysis chapter in the HNO, instead of each sector having a chapter on its own, but really coming together and really having an integrated chapter on that. Sorry, do others, maybe we can have some questions in 1 minute. I just have one more slide to share with you. I'm sorry, it's going very quickly. So you say, okay, this is great. So what is the next steps? The next steps, if you want ISC support, you can access me via email, kabla@unicef.org. If your partners are also interested in learning more about ISC, then they can go through the GNC website. There is a form to fill for support. The other thing that we could that would be helpful to us is if you have forms, if you have plans that you put together, if you have innovative programs that you have in a integrated manner, if you can share them with us so that we can increase the knowledge of everybody on ISC. And if you have a need for a form, if you have a need to know what integrated packages look like, you can email me and I can send you some examples. And then you can use that to really contextualize to the country where you're working. Questions? And I'm sorry that I've rushed through the end part here. Are there any questions? Any clarifications? I think Ghulam asked if we're going to share the presentation, and we're going to have it posted on the GNC website. Yes, and I could also just send a link to it. Okay, I guess if there are no clarifications or questions, I would like to thank you all for attending. I would like to thank Anthony for presenting, and Claude also for sharing his experience from the field, and thank Monica for taking the time to come and talk to us about the global aspect of the work that the 4 clusters are doing together on intersectoral collaboration. Maybe there is a question coming up. Thank you very much, Mutahar. Thank you. Yes, we can share best practices. We have two case studies that share also best practices, but also share constraint. This is another important aspect we're trying to collect, is the constraints that we see. But if you start with the two, the South Sudan and the Yemen case studies, you will take a look at best practices. But we will share. I will look at how the process, and you're asking exactly about the process, and we can see what there is available out there to share. Okay, thank you everybody. Thank you so much.
Thanks, Caroline. Thanks, everyone.
Thank you. Have a nice day.
Thank you. Thank you, everyone.
Bye-bye. Thank you.
Bye-bye. Bye.
Yes, bye.
Bye. Thank you.
Au revoir. Bye. Bye.